Why vaccination is necessary for the community. Hello everyone. In today's modern world where science and technology are continuously evolving, vaccination still plays an irreplaceable role in protecting public health. From ancient infectious diseases like smallpox and polio to new medical challenges like COVID-19, vaccines have proven to be powerful tools in the fight against dangerous diseases. But why is vaccination so important, and why do we need to get vaccinated? The importance of vaccination in public health. Vaccination is not only about protecting oneself from infectious diseases, but also a responsibility to the community. When a large percentage of the population is vaccinated, we create herd immunity, which helps prevent the spread of infectious diseases, especially those for which some people cannot get vaccinated due to health reasons. This not only protects vulnerable individuals such as young children, the elderly, and those with weakened immune systems, but also helps alleviate the burden on the healthcare system. The history and achievements of vaccines. Medical history has witnessed many remarkable achievements thanks to the development and implementation of vaccines. From Edward Jenner's invention of the smallpox vaccine in the late 18th century to the development of modern vaccines against flu, HPV, and COVID-19, vaccines have saved millions of lives and prevented billions of severe illness cases. These achievements have not only increased the average life expectancy, but also improved the quality of life for people worldwide. Present challenges and opportunities. In the current context, with the emergence of new virus variants and disease outbreaks, maintaining and strengthening vaccination programs has become more urgent than ever. Additionally, confusion and misinformation about vaccines are also significant challenges, reducing vaccination rates and increasing the risk of infectious disease outbreaks. As I, Dr. Mike, firmly believe, public health depends on the cooperation and collective effort of everyone. Getting vaccinated is not just a personal choice, but also a responsible act toward those around us. Let's work together to build a healthy, safe, and vibrant community by actively participating in vaccination programs and spreading positive messages about the benefits of vaccines. Stay tuned for more articles to learn about the harms of tobacco, nicotine addiction, and effective strategies for quitting. Essential knowledge to help you maintain the best possible health and quality of life. Dr. Mike. 2. Benefits of vaccination for the community. Hello everyone. Continuing from the introduction, we will delve deeper into the benefits of vaccination, not only for individuals but also for the entire community. Vaccination plays a crucial role in building a healthy, safe, and sustainable community. Here are the prominent benefits that vaccination brings. A. Creating herd immunity. One of the most important benefits of vaccination is its ability to create herd immunity. When a large percentage of the population is vaccinated, the spread of infectious diseases is significantly reduced. This not only protects those who have been vaccinated, but also those who cannot receive vaccines due to health reasons, such as infants, the elderly, and people with weakened immune systems. A practical example: before the polio vaccine was introduced, this disease caused thousands of deaths annually worldwide. Thanks to widespread vaccination programs, polio has been almost entirely eradicated in many countries. This is a clear example of the power of herd immunity in controlling and preventing the spread of dangerous infectious diseases. B. Prevention of dangerous infectious diseases. Vaccination helps prevent the emergence and resurgence of dangerous infectious diseases. Vaccines have proven their effectiveness in controlling and even completely eliminating some diseases that were once global health disasters. Smallpox. Before the vaccine, smallpox was one of the most common and dangerous infectious diseases, causing millions of child deaths annually. Thanks to vaccination programs, smallpox has been entirely eradicated in many countries. Polio was once a terrifying infectious disease, causing paralysis and death in young children. With the development of the polio vaccine, the disease has been nearly eradicated in many regions of the world. COVID-19. The COVID-19 pandemic highlighted the critical importance of vaccines in controlling emerging infectious diseases. COVID-19 vaccines have helped reduce severe cases and deaths while supporting the recovery of global economies and societies. These examples show how vaccines have been vital tools in preventing the spread of dangerous diseases and protecting public health worldwide. C. Protecting vulnerable groups. In every community, there are individuals who cannot receive vaccines or do not respond well to them due to health reasons. Widespread vaccination helps protect these groups by reducing the spread of diseases. For example, the elderly, infants, and individuals with chronic illnesses often have weaker immune systems, making them more susceptible to serious infectious diseases. Herd immunity ensures that these individuals are not directly exposed to infection risks, thereby minimizing the chances of illness and death. D. Reducing healthcare and economic costs. Prevention is better than cure is a golden principle in public health. Vaccination helps reduce the number of disease cases and prevents outbreaks, thereby significantly lowering healthcare costs and easing the economic burden on society. Cost savings on treatment. Preventing infectious diseases through vaccination reduces the number of patients requiring treatment, which in turn lowers the overall healthcare costs. The expenses associated with hospitalizations, medications, and long-term care are greatly reduced. Increased productivity. A healthier population means higher productivity and fewer disruptions in economic activities. When people are protected from diseases, they are less likely to miss work or suffer long-term health issues, contributing to the overall stability and growth of the economy. E. Protecting mental health and quality of life. The anxiety about contracting or spreading diseases can negatively impact individuals' mental health. When a community is fully vaccinated, the levels of worry and stress related to infectious diseases decrease significantly, improving the overall quality of life for everyone. For example, during the COVID-19 pandemic, many people around the world experienced heightened anxiety and stress. Vaccination helped alleviate this fear by providing an effective solution to control the outbreak, allowing people to feel more secure and at ease in their daily lives. F. Ensuring sustainable development of society. Vaccination not only impacts health but also contributes to the sustainable development of society. A healthy community serves as the foundation for economic, educational, and social progress. When infectious diseases are effectively controlled, resources can be redirected to other critical areas such as education, scientific research, and technological development, thereby promoting comprehensive and sustainable growth. G. Encouraging vaccination in the community. Vaccination should be viewed as a community responsibility. Educating and raising awareness about the benefits of vaccines is crucial to encouraging participation in immunization programs. Effective communication campaigns, collaboration with community leaders, and providing accessible vaccination sites are key elements to increasing vaccination rates and protecting public health. Vaccination is not just a personal protective measure, but also a duty to the community. The benefits of vaccination, from creating herd immunity and preventing dangerous infectious diseases to reducing healthcare costs and protecting mental health, all highlight the importance of vaccines in modern society. Dr. Mike always encourages everyone to see vaccination as a vital part of a healthy lifestyle and social responsibility. Starting today, join vaccination campaigns and contribute to building a healthier, safer, and happier community. 3. Confronting myths and misunderstandings about vaccines. Below everyone, while vaccination provides numerous tangible benefits for both individual and community health, there are still many myths and misunderstandings surrounding vaccines, causing some people to feel anxious or refuse vaccination. This not only impacts personal decisions but can also have serious consequences for public health. Let's analyze and confront the most common vaccine myths to gain a clearer understanding and dispel unfounded concerns. A. Myth: vaccines cause cancer. One of the most common misconceptions is that vaccines can cause cancer. Many people worry that the components in vaccines might damage DNA or stimulate cancer cell growth. However, rigorous scientific studies have found no evidence to support this claim. Fact: the ingredients in vaccines are thoroughly tested for safety before approval and widespread use. None of the substances in vaccines have been proven to cause cancer. Trusted sources: Both the World Health Organization, WHO, and the Centers for Disease Control and Prevention, CDC, confirm that there is no link between vaccines and cancer. Myth: vaccines weaken the immune system. Another misconception is that vaccines weaken the immune system, making individuals more susceptible to illness. In reality, vaccines strengthen the immune system by training the body to recognize and fight disease, causing agents without causing the actual disease. Fact: vaccines stimulate the immune system to produce antibodies and memory T cells, enabling the body to respond quickly and effectively when encountering the virus or bacteria in the future. Trusted sources: clinical studies and long-term follow-up have shown that vaccinated individuals have stronger immune responses and are less likely to suffer from severe diseases. Myth: vaccines are unnecessary if you are healthy. Some people believe that vaccines are unnecessary if they feel healthy and are not at risk of serious illness. However, vaccination not only protects individuals but also safeguards the community. Fact: even healthy individuals can contract dangerous infectious diseases and spread them to others. By getting vaccinated, you contribute to herd immunity, reducing the risk of transmitting diseases to those who cannot be vaccinated, such as infants, the elderly, and people with weakened immune systems. Trusted sources: the World Health Organization, WHO, recommends that everyone, regardless of current health status, should get vaccinated to protect both themselves and the community. Myth: vaccines contain harmful ingredients. Another common myth is that vaccines contain harmful substances like mercury or formaldehyde, which can harm the body. While some older vaccines contain these substances in very small amounts, scientific studies have shown that the levels used in modern vaccines are safe and do not negatively impact health. Fact: substances like thiamersyl, a mercury-containing compound, have been removed or reduced to safe levels in most modern vaccines. Formaldehyde, which is necessary in the vaccine production process, exists only in trace amounts in vaccines, and our bodies naturally produce and eliminate it without harm. Trusted sources: leading health agencies such as the Centers for Disease Control and Prevention, CDC, and the Food and Drug Administration, FDA, confirm that vaccines are safe and do not contain harmful substances at levels that could harm the body. Myth: vaccines are ineffective. Some people believe that vaccines are ineffective or that diseases which have disappeared were eliminated by chance rather than by vaccines themselves. However, robust scientific evidence has proven that vaccines are among the most effective medical tools for controlling and eradicating infectious diseases. Fact: global vaccination programs have successfully eradicated diseases like polio and smallpox in many countries. Additionally, flu and COVID-19 vaccines have significantly reduced the rates of infection and death. Vaccines not only prevent illness but also help lower the transmission rates within communities. Trusted sources: numerous clinical studies and real-world data from countries with widespread vaccination programs demonstrate that vaccines are effective in preventing diseases and reducing transmission rates. Myth: new vaccines are not thoroughly tested. With the rapid development of medical technology, some people worry that new vaccines are not thoroughly tested and may cause serious side effects. However, new vaccines must go through rigorous testing phases before being approved and widely used. Fact: before approval, vaccines must undergo large-scale clinical trials to ensure safety and efficacy. This process is closely monitored by international and national health agencies. Trusted sources: organizations like the World Health Organization, WHO, U.S., Food and Drug Administration, FDA, and European Medicines Agency, EMA, ensure that new vaccines meet stringent safety and effectiveness standards before they are approved for widespread use. Addressing and debunking myths and misunderstandings about vaccines is a critical step in raising awareness and increasing vaccination rates within the community. Education and the provision of accurate information are key to reducing fear and anxiety, thus encouraging voluntary and proactive participation in vaccination programs. Dr. Mike always encourages everyone to seek out and trust reliable information sources, consult with healthcare professionals without hesitation, and share accurate information with family and friends. By doing so, we not only protect our own health but also contribute to building a healthier, safer, and happier community. 4. How vaccination protects the community. A. Herd immunity. Herd immunity is an essential concept that everyone should understand when discussing vaccination. When a large proportion of the population is fully vaccinated, the spread of infectious diseases is significantly reduced. This not only protects vaccinated individuals, but also those who cannot receive vaccines due to health reasons, such as infants, the elderly, and individuals with weakened immune systems. Real-life example, before the polio vaccine, the disease caused thousands of deaths annually worldwide. Thanks to widespread vaccination programs, polio has been nearly eradicated in many countries. This is a clear example of the power of herd immunity in controlling and preventing the spread of dangerous infectious diseases. B. Preventing dangerous infectious diseases. Vaccination is a powerful tool for preventing the emergence and resurgence of dangerous infectious diseases. Vaccines have proven highly effective in controlling and even eliminating some diseases that were once global health disasters. Smallpox. Before the vaccine, smallpox was one of the most common and dangerous infectious diseases, causing millions of child deaths annually. Thanks to vaccination programs, smallpox has been entirely eradicated in many countries. Polio was once a terrifying infectious disease, causing paralysis and death in young children. With the development of the polio vaccine, the disease has been nearly eradicated in many regions around the world. COVID-19. The COVID-19 pandemic highlighted the critical importance of vaccines in controlling emerging infectious diseases. The COVID-19 vaccines helped reduce the severity of cases and death rates, while also supporting the recovery of global economies and societies. C. Protecting vulnerable groups. In every community, there are individuals who cannot be vaccinated or do not respond well to vaccines due to health reasons. Widespread vaccination helps protect these groups by reducing the spread of diseases. Example, the elderly, newborns, and individuals with chronic illnesses often have weaker immune systems, making them more susceptible to severe infectious diseases. Herd immunity ensures that these individuals do not have to face direct exposure to infections, thereby significantly lowering the risk of illness and death. D. Reducing healthcare and economic cost. Prevention is better than cure is a golden principle in public health. Vaccination helps reduce the number of disease cases and prevents outbreaks, thereby significantly lowering healthcare costs and alleviating the economic burden on society. Cost savings on treatment. Preventing infectious diseases reduces the number of patients needing treatment, leading to overall lower healthcare costs. Increased workforce productivity. A healthier population results in higher productivity and minimizes disruptions to economic activities as fewer people fall sick and miss work. E. Protecting mental health and quality of life. The anxiety about contracting or spreading diseases can negatively impact an individual's mental health. When a community is fully vaccinated, the levels of worry and stress related to infectious diseases decrease significantly, improving the overall quality of life for everyone. Example, the COVID-19 pandemic caused widespread anxiety and stress globally. Vaccination helped alleviate this anxiety by providing an effective solution to control the spread of the disease, allowing people to feel more secure and at ease in their daily lives. F. Ensuring sustainable development of society. Vaccination not only impacts health but also contributes to the sustainable development of society. A healthy community forms the foundation for economic, educational, and social progress. When infectious diseases are effectively controlled, resources can be redirected to other critical areas such as education, scientific research, and technological development, fostering comprehensive and sustainable growth. G. Encouraging vaccination in the community. Vaccination should be seen as a responsibility toward the community. Educating and raising awareness about the benefits of vaccines is crucial to encouraging participation in immunization programs. Effective communication campaigns, collaboration with community leaders, and providing accessible vaccination sites are key elements in increasing vaccination rates and protecting public health. 5. Encouraging vaccination in the community. A. Education and raising awareness. Education is the most crucial foundation for encouraging people to get vaccinated. When individuals clearly understand the benefits and safety of vaccines, they are more likely to participate in vaccination programs. Key approaches: providing accurate information. Share materials, articles, and videos from trusted sources such as the World Health Organization, WHO, the Centers for Disease Control and Prevention (CDC), or local health authorities. Accurate information dispels myths and builds confidence in vaccines. Organizing workshops and seminars, invite healthcare professionals to speak about the benefits of vaccines and answer questions from the community. These direct interactions help reduce hesitancy and build trust in the safety and importance of vaccination. Leveraging social media, use the power of social media to spread positive messages about vaccines. Share success stories, provide the latest updates, and address common concerns. Social platforms are excellent tools for engaging a broader audience and promoting vaccine awareness in real time. Creating easy and accessible vaccination opportunities. To increase vaccination rates, it is crucial to make vaccination easy and accessible. Key approaches: providing multiple vaccination locations. Ensure that vaccination sites are widely distributed within the community, including rural and remote areas. This helps reach populations that may otherwise have difficulty accessing healthcare services. Extended hours of operation. Offer flexible vaccination hours, including evenings and weekends, to accommodate the schedules of working individuals and families who may find it hard to attend during regular hours. Offering free or low-cost vaccination. Provide financial support or subsidies for individuals with low incomes or those unable to afford vaccines. Ensuring cost is not a barrier allows everyone the opportunity to get vaccinated, contributing to overall community protection. C. Collaborating with community leaders. Support from community leaders can have a significant impact on encouraging vaccination. Key approaches: engaging religious and social leaders. These leaders can spread positive messages about vaccination during religious ceremonies, meetings, and community activities. Their influence helps build trust and encourages people to participate in vaccination programs. Partnering with local organizations. Collaborate with schools, companies, and volunteer groups to organize vaccination campaigns. These organizations can help reach diverse segments of the population, making vaccination more accessible. Leveraging celebrities and influencers. Well-known figures or community influencers can share their vaccination experiences, encouraging others to follow suit. Their reach and credibility can be powerful tools in promoting vaccine acceptance. D. Effective media campaigns. Creative and effective media campaigns can greatly increase awareness and encourage people to get vaccinated. Key strategies: use positive messaging, focus on the benefits of vaccination, such as protecting yourself and loved ones, reducing the risk of severe illness, and contributing to a healthier community. Positive messages inspire confidence and action. Create engaging content. Utilize visuals, videos, and infographics to make the message more lively and easy to understand. Engaging content helps capture attention and simplifies complex information. Target specific audiences. Tailor messages and choose appropriate media channels to reach different groups, from children and young adults to the elderly and those with specific health conditions. Customizing content ensures that it resonates with the intended audience. E. Encouraging through programs and incentives. Incentive programs and benefits can be powerful motivators to increase vaccination rates. Key strategies: offer gifts or incentives, provide small rewards such as vouchers, discounts, or gifts for people who get vaccinated. These incentives can make the process more appealing and motivate participation. Host special events. Combine vaccination efforts with fun or cultural events to create a friendly and relaxed atmosphere. This helps make vaccination feel like a positive community experience. Workplace encouragement. Companies can encourage employees to get vaccinated by offering paid time off or additional benefits. Workplace incentives not only motivate individuals but also contribute to overall workplace safety and health. F. Dealing with confusion and misinformation. Confusion and misinformation are major obstacles to increasing vaccination rates. To overcome these challenges, we can take the following steps. Build trust. Ensure that information about vaccines is provided transparently and honestly. Address all concerns and questions from the community in a thorough and empathetic manner to foster trust. Counter misinformation. Monitor and respond to misinformation on social media and other communication platforms. Provide scientific evidence and expert advice to counter false claims and ensure the public has access to accurate information. Improve communication skills. Train healthcare workers and community leaders on how to effectively and persuasively communicate vaccine information. This helps ensure that key messages are delivered clearly and resonate with the community. G. Using success stories and testimonials. Success stories and testimonials from people who have been vaccinated can be a powerful tool to encourage others to get vaccinated. Key strategies: share personal experiences. Individuals who have been vaccinated can share their experiences and the benefits they received, motivating others by showing the positive impact of vaccination. Create testimonial videos. Produce short videos that capture real success stories of people who have been vaccinated and share them on social media platforms. These personal accounts can help reduce fears and hesitancy by making the experience relatable. Incorporate stories in media campaigns. Use real, life stories in media campaigns to make the message more relatable and convincing. Genuine testimonials can make the message feel personal and authentic, thus resonating more with the audience. H. Evaluating and improving encouragement strategies. Evaluating the effectiveness of vaccination encouragement strategies is crucial to ensuring they are meeting the intended goals. Key strategies: collect feedback from the community, use surveys, interviews, and focus groups to gain insights into the community's needs and perspectives. This feedback can help identify areas where improvements are needed and uncover potential obstacles. Analyze vaccination data. Track vaccination rates and identify areas or demographic groups with low uptake. This analysis allows for strategic adjustments to target specific groups or regions more effectively. Continuous improvement. Based on the feedback and data collected, continuously refine and enhance the strategies to ensure optimal effectiveness and reach. Adaptation and flexibility are key to addressing emerging challenges and maintaining progress. As Dr. Mike always believes, with the right understanding and support from those around us, each of us can contribute to building a healthier, safer, and happier community. Let's start today, be part of the solution, and together we can create a brighter and more sustainable future for everyone.